This is part 2 of the Radiologic Technology online orientation, the profession and the program. The radiography profession may entail more than you realize. The radiology profession includes taking x-rays of broken bones, inserting catheters into various openings in the body, and injecting contrast media into veins and arteries. Portable radiology is standard protocol for patients that are too ill or injured to come to the radiology department. Radiographers are part of a trauma team. Portable radiography is utilized in the emergency department when trauma patients require x-rays. We are frequently called to the morgue to take portable x-rays when a homicide or a suicide is the suspected cause of death. Radiographers routinely perform portable radiography in the nursery on neonates. Images are also necessary for operating room procedures. Portable C-arms are used to provide dynamic or real-time images for the surgeons during procedures. Portable X-ray machines are used for static images. Radiographers are involved in pediatric imaging on a daily basis. Working with children can be inspirational and challenging at the same time. Many times, radiographers are required to safely restrain children in order to obtain diagnostic images for the ordering physician. The scope of practice for radiographers includes caring for patients placed in their charge. We administer emergency care when needed, inject contrast material, clean wounds and buttocks, as well as empty urinals and bedpans. Radiographers are potentially exposed to infectious diseases, including blood-borne pathogens such as HIV and hepatitis B. We are trained to wear personal and protective equipment to protect ourselves. Patient safety and radiation protection are very important in our field. Radiographers operate extremely technical equipment. We are responsible for the patient's safety when using these high-tech machines and are highly trained in radiation protection laws and principles. Radiographers are educated to understand the technology behind the buttons they push. We spend many hours in X-ray school learning about the circuitry, generators, and motors that are the heart of the X-ray machine. We are also taught how to minimize patient dose by utilizing appropriate exposure factors when preparing our machines for imaging procedures. There are many emotional and physical demands in this field. Radiographers stand on hard surfaces from several minutes to hours while performing their job. Sometimes we have to wear 5 to 10 pound lead aprons during this time. Other physical demands include being able to push and pull up to 300 pounds. Although we have devices available to aid with difficult patient transfers, the job requires sound physical health. Persons with joint and back deficits would most likely be faced with certain barriers while trying to perform their duties. Frequently, radiographers work with their arms overhead while manipulating the equipment for a procedure. The program director does reserve the right to request a medical clearance at any point during the program if it is suspected that a student is not able to function at full capacity in any of these areas. Dim lighting is commonplace in radiology departments. Dim lighting allows us to view our images on monitors for accuracy prior to submitting them to the radiologist to be read. It is imperative that radiographers are effective communicators. No matter our specialty, our healthcare workers have a common goal, and that is to provide the patient with the best care possible. It takes all of us working together to make a difference in our patients' lives. Effective communication is key in allowing us to reach this goal. Diversity. Our patients come in different shapes, sizes, and cultural backgrounds. Many of our patients have physical and mental disabilities. We must find a way to communicate effectively for all of our patients. RTE 101, Introduction to Radiography. This is the course you will be applying for. Students who are selected from the fall application process are eligible to register for RTE 101 spring semester. This course is called Introduction to Radiology and is another stepping stone to gaining final acceptance into the program, which begins each fall semester. RTE 101 is a highly competitive class. We have a responsibility to students and the college to make every effort to fill our program with a full cohort each fall. For this reason, it is necessary to create a pool of alternates. The number of students invited to register for RTE 101 exceeds the number of final acceptance offers that will be given for fall program of the same year. Students are ranked during RTE 101. Those earning the highest GPA during RTE 101 will be offered a program start for fall of the same year. Students not selected to start the program for fall of the same year will be given an alternate status. The number of final acceptance offers and alternates varies each year. Students who are given an alternate status are still offered a program start. Alternates should expect to be on standby in case a seat becomes available for fall program of the same year. If no seats become available, alternates are offered a program start the following year. RTE 101 is what we call a screening course and allows the student and the program time to investigate and evaluate whether or not this profession is the right fit for the student. Are you comfortable with doing patient care, doing traumas, going to the morgue, imaging during surgery? We want to set all students up for success. Also, during this program, students will be exposed to all aspects of the profession and are required to sign up for a hospital tour and conduct interviews with people in the field. Some years, students are required to do 8 hours of observation in a radiography department as well. Successful completion of RTE 101 does not guarantee final acceptance. Students must pass a series of performance evaluations to earn final acceptance into the program. Students are allowed to attempt RTE one time. Students who earn a D or F or withdraw from the course are not eligible to take the course again. A final grade of C or higher must be earned in this course to advance into the program. There are 4 performance evaluations that must each be passed with 80% or higher. Final acceptance into the program will not be granted for students not meeting the standard on any of the performance evaluations. Students who successfully complete RTE 101, including alternates, and decline final acceptance into the program, are not automatically offered an extended acceptance for the following year. A formal written request must be submitted to the department chair, requesting an extended acceptance. The department chair reserves the right to decline such a request. If extended acceptance is not granted, students are no longer eligible for the program. The program, after successful completion of RTE 101. Students need to know up front not to make plans the summer prior to starting the program. A mandatory program orientation will be held toward the end of May for those students that successfully complete RTE 101 and were invited to the program in the fall. Students will be doing multiple online clinical site orientations and training modules, getting immunizations, drug screenings, background checks, etc. Students will be meeting with the program director in person for immunization checks and more. There are many deadlines and windows for getting these things done. In other words, you will be busy from the end of May to the beginning or mid of August, the summer prior to starting the program. These deadlines and tasks are mandatory and necessary to meet the specific requirements of the clinical sites. These deadlines and tasks cannot be worked around long vacations, etc. The Radiologic Technology program starts each fall semester. Seats are filled with students who have successfully completed RTE 101. Yearly enrollment is limited and the number of invites is subject to change each year depending on the job market at the time. Enrollment is also limited due to the number of labs at the college, classroom size, and the number of students that can be placed at each clinical site. During the program, students rotate through 4 primary clinical sites for their internship hours. Students are placed at these sites with other students. North Colorado Medical Center in Greeley, McKee Medical Center in Loveland, Poudre Valley Hospital in Fort Collins, and Longmont United Hospital. Most years, students are also placed at smaller sites by themselves for one semester as well. We are guests at these clinical sites, and students are expected to act professional at all times. Any student who is banned from a clinical site will be dismissed from the program immediately. Students should also be aware that if they are banned from a clinical site, they will not be allowed to enter into any allied health program at Ames. Commuting can be time-consuming and expensive. Students rotate through multiple sites during the program. Students must expect a lot of commuting, and some of it in bad weather. All schedules and rotations are determined by program faculty and cannot be made to work around personal work schedules. Clinical schedules are given to students at midterm the semester prior. Each semester, students rotate through various shifts at their clinical sites. Weekday shift, 7:30 to 4 p.m. Weekday evening shift, 1 to 9:30 p.m. Weekend day shift, 7 to 3:30 p.m. Weekend evening shift, 1 to 9:30 p.m. If students anticipate working during the program, they need to realize that clinical schedules are not individualized to accommodate work schedules. All times are subject to change. The first and second semesters of the program, the students are in the clinical environment 16 hours a week. Throughout the course of a semester, or 16 weeks, the students will work various shifts. The third semester of the program, summer semester, students are at the clinical site for 40 hours a week for 8 to 9 weeks. All of the previously listed shifts are worked with the addition of a possible graveyard rotation and or an early morning rotation, for example, 5 a.m. During the fourth and fifth semesters of the program, students are at the clinical sites 24 hours a week for 16 weeks. All of the previously listed shifts are worked. Approximate classroom schedule. Times may vary from year to year, but students will choose either a morning or an afternoon section. First and second semesters, students are in the classroom Mondays and Wednesdays, 5 to 6 hours both days. Third semester students attend clinical only, and that's 40 hours a week. Fourth and fifth semester students are in the classroom Tuesdays and Thursdays, 3 to 4 hours both days. Students again will choose from 2 sections. Sections are first come, first served. There are no exceptions. Students should be aware that the morning section can start as early as 7:40 a.m., and the afternoon sections can go as late as 4:40, depending on the semester. All times are subject to change. A personal, updated computer is highly recommended. Currently, the program has 1 online class and anticipates more to come. All classes in the program utilize the web to post certain class materials, practice worksheets, reviews, and schedules. It is highly recommended again that students have an updated personal computer prior to entering the program. Computer labs are available on campus for students who do not have computers at home. Students successfully completing the Radiologic Technology program are eligible to take the American Registry of Radiologic Technology. A 75% or higher is required to pass the ART registry exam. Therefore, the program grading scale parallels the scoring system for all assignments and final grades. This grading scale starts during RTE 101. Performance evaluations are administered in the classroom and at clinical during the program on real patients. All performance evaluations must be passed with an 80% or higher. Unlike RTE 101, students may be allowed to move on in the program if below 80% is earned on these performance evaluations. Students earning below 80% are required, however, to repeat the evaluations to prove competency, with the first grade earned being recorded. There are rules and restrictions surrounding the number of times a student may repeat a performance evaluation, and program expulsion is a possibility. Students are assessed at the college in the labs first and second semester for knowledge retention. Patient procedures are simulated, and students are not told in advance which procedure they are being assessed on. Students who do not pass a retention assessment are put on probation, and a mandatory personalized tutoring plan will be put into place. Students may be placed on probation one time during the program, or they are dismissed. Students that do not pass 2 assessments are not eligible to continue in the program. Classroom attendance. Attendance is mandatory for all classes. Deductions are given for tardies and absences in the classroom. Personal days are given for internship, with grade deductions given once they are exhausted. Attendance must be at least 80% of scheduled time for each course. Students missing more than 20% of assigned time will be dismissed from the program. Tuition and program costs. There are 3 different levels of tuition: in-district, out-of-district, and out-of-state. We encourage students to go online at www.ames.edu to check the tuition rate that applies to them. In addition to the 3 basic levels of tuition, differential tuition rates apply to specific high-cost intensive technology programs. The Radiologic Technology Program is one of these programs. You may ask your allied health advisor for an estimated program cost sheet. There are additional program costs that students should think about as well. Books for the program are approximately $700. The majority of the books are purchased the first semester for the entire program. Students are required to wear approved uniforms for clinical. Gas and wear and tear on your vehicle should also be calculated into your plan. Clinical sites have certain requirements that students must meet before they are allowed to practice at their site. The cost of these requirements is endured by the student and includes such items as immunizations, background checks, and drug screenings. Students failing to follow protocol and/or to submit documentation of clinical site requirements by the assigned due dates will endure an automatic letter grade deduction off their final clinical grade first semester. Students who fail to submit documentation at all will be dismissed from the program. After program graduation and ARRT certification, technologists have many areas within medical imaging they can advance into. All additional modalities have separate registry requirements and can increase your hourly wage. Thank you for your interest in our program. We hope to see your application someday.